pregnancy diabetes, which we call it
Yeah,
gestational diabetes, is very
gestational.
much linked with special need, children's special need
Yes.
things. The reason is there's a lot of reason. Let me just see if I can explain it easily. So this is a big research came as well that they took a lot of history for these children who are special need, and they took the history that were their mother diabetic that time. Yes, they were most of the time. So the reason is there is, the blood um, sugar level, it's spike, and it controls the whole our metabolism system, because that insulin comes, and when the insulin is not coming and you are having too much sugar in the body, which is happening a lot of time during the pregnancy,
Yeah.
then this is like your body is not able to send sugar inside the cells, so the blood is called sweet blood, yeah.
Yes.
And this is not good for mom, not good for the child as well. So this is one of the thing. The other thing is, um, lot if this diabetes is not controlled during the pregnancy, and a lot of sometimes it can be hidden. Sometimes it comes very later part of the pregnancy, because normally after 6 months they don't check. But I found a few cases where it came very late, and then they didn't know. So child was um, growing up in the last stage of the pregnancy, was in this uncontrolled diabetic situation in the womb. And then that too much sugar, not sugar, too much sugar, not sugar, it could create some other birth trauma as well. So that is
Okay.
just before the child is born.
Born. Yeah.
After the child is born, now there is, of course, if this is not controlled, if there is some children, if their mom's diabetes was not controlled properly when they're born, they can be having severe sugar limitation in the body, and that can create lots of medical issues as well. When this child is, if in case if it's not controlled for a long time, so there is a chance for they're getting um, type 1 diabetes, which starts from basically childhood, and then type 2 is mostly for adult. So um, you said that, is food related to this or not? Yes, of course, food is 100%, and this is one of the disease, I wouldn't say disease, is I would say health condition,
Yep.
where we can see that how food is related,
Yes.
this condition. So the main thing is there are two reasons. It could be for you are not having enough insulin in the body. Either people are having too much sugary food, and then body, every time we eat sugary food, the insulin has to come. Yeah, it's a hormone. It has to come, and it has to dilute this sugar and take it out of the blood, take it into the cells, and process it properly. But now, if somebody is having too much sugar all the time, and lack of exercise, then what's happening? This insulin is not enough. The insulin body is producing is not covering all sugar. So there are a lot of sugar stress remains in the blood. And then after a long time, it can cause, other health issues, including diabetes.